the risks of diabetes is developing a wound that does not heal. So what are the medical advices we should be giving to people that have this case?
You don't want to get to that case. Because for you to develop a wound that does not heal means your diabetes has been poorly controlled. And by the time you're having that wound, you already have neuropathy. And that is your nerves, so to speak, are affected. And before that neuropathy, your eyes are gone. Your kidneys have already been knocked before you can have a neuropathy. So all in all, you've had poor diabetes control. And I'm afraid you are exactly in the point of no return. The most important thing is for it not to occur at all, and for you to manage the diabetes. I mean, if you manage the diabetes well, then there's no discussions about having a wound that will not heal. You're having it because you've been poorly controlled. So from the word get-go, the determination should be that I will control this well. Seek opinions. If you're fat, begin to lose weight seriously. Begin to lose weight seriously. The treatment that the doctors has commenced you on metformin, which I know is the standard treatment everywhere, that they've started you on metformin. Metformin, yes, even here is level 1. You start with metformin. You max up the dose of metformin, you add on, you add on, you add on, you add on. Yes, things are difficult at home, but health is just as important. It's just as important. And there should be a determination to help oneself in doing things. It's not taking your tablets for 2 weeks and for the next 6 weeks nothing happens. It's lifelong treatment of diabetes. There's no cutting corners with it. Because if you cut corners, unfortunately, that's when you start having what you just said. A wound that will not heal. If you get there, it's no good.
It is not good.
Equally with somebody that does not have diabetes, and then suddenly you have this wound and it's not going away. So that is really a wake-up call to go and get checked, get a medical checkup. Because sometimes we know that the diabetes, if it's not managed, then this is the problem. So if you don't know you have diabetes, which type 2 diabetes, a lot of people don't know they've got it. So that wound may well be the thing that leads to being diagnosed. So something like that is good to go to a clinic, get checked to know could the person have undiagnosed diabetes.
And from what you are saying, it reminds me of one common thing that happens, they call it otere. So this otere, it's a common, it's very common in eastern part of Nigeria. Don't know how we will link it with diabetes, because some of the people have had or have that particular otere. They only get diabetes. I don't know whether it can be linked to diabetes, because otere, they say that it's something that somebody
curse, juju, poison, something,
sent to, or but I don't know whether we can link it to diabetes or whatever. Is it?
If I understand what you're saying, you call it otere. I've heard people call it achere. Achere is a lightness. And essentially, it's when there's infection underneath the skin. Okay? And that infection just spreads underneath the skin. It's quite red, it's quite raw, and there's swelling. Very painful. Okay? And obviously, there's pus formation there. Okay? And what you really need is not going to the nearest native doctor. You really need a good going course of antibiotics, proper antibiotics, because it's just infection underneath the skin. So what you need is antibiotics. You need to see a doctor And I would believe for that kind of cellulitis, you will need the antibiotics given through the vein. It might be a week, it might be 10 days. That's what you need, not a native doctor. Because what's going to happen is the antibiotics will contain the infection. And over time, the swelling will come down, the pain will come down, and eventually things will settle. Sometimes the abscess formation there might just need draining, and you let out the abscess and continue with antibiotics. Nobody did it. You didn't step on anything, as our people believe. Each and every one of us, we all harbor bacteria on our skin. And for some reason, and at that point of weakness for us, okay, there's a cut. You might not even see it, something minuscule that you don't even know it's there. And that becomes the entry point for the bacteria to get under the skin, and then it begins to spread. And that's the source. Even if you look, you won't see any mark. For the light-skinned people, sometimes you're able to mark it, because here, you kind of mark it with pen, and you just see it spreading beyond that mark. So it's just the infection spreading within your subcute. And all you need to do, it will keep spreading until the antibiotics kicks in, and you see that it will not extend beyond that part that you have marked. So yes, it's an infection. The next question, why did I get the infection? You get it because we get it, that's life. Infections are infections, you just get it. And it's there, you deal with it. Nobody did any automopo on anybody in this particular case. It's not an automopo. You did not maybe you stepped on something that cut your skin, I will buy that. You may step on something that will cut your skin that you're unaware of, and that became the portal of entry, and it spread like that. It is very important you go to a hospital and you have antibiotics for it.
Wow, this is very true, because I remembered one of my sisters who was telling me about an in-law who had that wound on his leg. So all of a sudden they said that otere, they were just treating with local medicine. The wound was not healing at all, and the leg was really decaying. All of a sudden somebody called the husband in the city, and the husband went home and rushed the dad to hospital. The doctor saw it and said, oh my God, it was only infection, and placed him on antibiotics. And the man was...
It's just an infection.
Similar to if you have malaria, you go and get malaria treatment, isn't it? You don't start going to or thinking somebody did you the malaria or the shit.
Someone asked question on diabetes. So this person said that her mom had an issue. So that night she was sleeping deeply asleep. So all of a sudden she was snoring, and the snoring was so strange to the brother. The brother had to rush to find out if the mom was okay. So when he rushed to the mom's room and tried to wake the mom up, he noticed that the mom was not responding anymore. They had to rush the mom to hospital, and they gave the mom an injection. When the mom woke up, the mom was asking what happened, and she was she's still alive with him. She's a diabetic patient. So what might be the cause?
Hypoglycemia.
Hypoglycemia.
The injection is, they're lucky they have the glucagon. It's like the hypoglycemia.
So probably if she's on insulin, or maybe even the other tablets, not apart from metformin, so depending on when she took her last medication and when she took her last meal. Because remember, at night time we have longer period when you're sleeping at night, you're not eating, you're not drinking anything, compared to daytime. Daytime you might have a banana or have some peanuts that will keep you going throughout the day. But at night time, so she may well have taken her medication for the night and then gone to bed, but unfortunately her blood glucose have dropped during her sleep. And of course, that means she's got no way of waking herself. She's got no awareness that this is happening. So luckily she had the family member there that could react. Because with that condition, with diabetic coma, it would be death if it's not treated quick enough. Then that's where, what then can we do? So if you are on a diabetic medicine other than metformin, if you have the opportunity to be able to test, it's a good idea to test your blood sugar before you go to bed at night. And then we think, consider when was it you had your last food before going to bed. If it's been, say, more than 3 hours, it's a good idea to have something light to eat. If your medication is the one that will cause your blood sugar to drop if you fasted for a long period. And then nighttime you have good 8 hours, isn't it, when you're not eating or drinking anything. So it's good practice to, depending on when you had your last meal and your medication, do you need to have something small? We're not talking about another full meal, but something small to eat before you go to bed.
In addition to what Dr. Duru just said, it depends on the type of insulin you are on. Because I know in Nigeria, they tend to have a combination of Humulin 30. It appears the most common, and the Novomix 30. Okay. What that 30 tells you is that it's the short-acting element of that insulin. And what it means in the real world for you is that, in addition to monitoring, because if you're on XYZ dose, you need to keep monitoring to know what, is it too much, am I at the right place? Monitoring is vital. But the type of insulin, the 30s that you have back home, that 30, what it's suggesting to you is that if you're having, because it's usually twice a day, in the morning and in the evening. So if you're having it at breakfast, let's say breakfast is at 8 o'clock, strictly speaking, it peaks at that 30, which is about 2 hours after you've had it. Therefore, you should have a biscuit there, or half a gallon. Then you have your lunch. Okay, so that 30 is still up there. It covers part of your lunch, and 2 hours after lunch, it's beginning to come down. You need another snack there, because that's when it's at its peak. So you need breakfast, you've had something to eat. Have a little bit of, even if it's orange or even a banana. You need to have it 2 hours after you've had your breakfast. Then you've had lunch. 2 hours after you've had your lunch, you should have something. Then come at about 5 o'clock, you have your evening dose. The same process happens again. So after eating, 5, 6, you should have something else to eat that has carbohydrate before you go to bed, or else the insulin is at its peak. And anybody on insulin, you are at risk of having a hypoglycemia at any time. All you're doing with these mixed insulins is at their peak action points. You're giving it more sugar so that it has what to work with, or else it's going to crash you at those points. So it's very important that you're aware of the insulin you are on. You have regular, especially in this mix 30s, if that's what you are on. There are other mixes, but I don't believe you have it so much in Nigeria. You have your mix 20, you have your mix 10 and stuff like that. It's still the same thing, because all it's telling you is 10% short acting, 90% longer acting, and it will last you longer late into the evenings. But you need to have something to eat at those peak action points and be aware of symptoms of hypoglycemia. Okay. The commonest thing that kills any diabetic in sleep is the death in bed, is hypoglycemia.
Hypoglycemia.
That's a low blood sugar.
When it's low, that's the commonest thing that kills in sleep. So somebody is hale and healthy, whatever, goes to bed, won't come out in the morning. Non-diabetic, you've had a serious hypoglycemic event, truly an arrhythmia, and dies in the sleep. So it's so important that people are aware of the signs of hypoglycemia, symptoms of hypoglycemia, and how to treat it. If you are on insulin, yes, you have a risk of it. So you must carry those sugary drinks and biscuits.
Oh, this reminds me of someone that died in our village, and the person was diabetic, and she was planning to go back because they came back for Christmas. She was planning to go back the next day. Night she slept and she didn't wake up.
That's correct. That's in bed.
Oh my God.
Because maybe the other lady you mentioned, if the son hadn't gone in to check and then transfer her to the hospital, to then where they gave her the glucagon to reverse the action of the insulin and then give her some glucose, she would have died.
True.
She would have died from
Very true.
Because the blood glucose drops and that's it, it's dropped until you put glucose. And to put glucose, you've got to eat and drink.
no.
So if you're not eating and drinking and nobody is giving you the injection, of course,
Death.
so it can be serious also. You need to know exactly what you need to do.
Wow. High blood pressure and diabetes. This from what we've discussed, it's really important that we really need to take good care of our health, because high blood pressure, diabetes, they are not, what will I say, death. There are things that can be managed.
Listen, you can do the
our
full
lifestyle,
Easily.
just maintain a very healthy lifestyle and eating healthy. Don't drink too much. That's why. In moderation. Odeku, in moderation. Nkwobi, in moderation.
Yeah.
Cigar, not at all.
Yeah, that's the one that should be not at all.
Should not at all. So these are those things. Please let us not be afraid. These are those things those kind of diseases that can be managed with, the way we live our lives and what we eat. And we have to be extremely careful if we really maintain a very healthy lifestyle. I think there is no cause to alarm, right? Yeah.
Some exercise.
Yeah. Exercise.
Alcohol, moderation, cigarette, if you can not do it at all, that's better. But if you must, in moderation.
Exercise, and swimming, right? I heard of swimming.
Swimming, walking around.
Walking.
Going on a walk.
Walking. Back home is the weather there is very hot, and yes, you don't want to be outside for too long, but in the early hours of the day, you can wake up in the morning, go for your walking. You don't have to join the gym because that's a cost, but if you can afford it, then why not? But if you can't afford it, you plan your day, so you allow that extra time, either the beginning of the day or the end of the day, when it's not so hot. So you can all you need to do is brisk walk, 30-45 minutes. If you can do that 5 times a week, that is really all you need. And then of course you then manage your diet, so what you're eating is not more than the energy you're putting out.
No. Please, thank you so much, Dr. Osla. Thank you so much, Dr. Choba. Honestly, you've given us enough information about diabetes and high blood pressure and how we will keep our health in a very good, what will I say, good
understandable, simple
standard. No, it's really enough information. Sometimes, honestly, we need this information because even those that are educated are not even, they don't think, they are very nonchalant about their health. Sometimes I wonder, little things you are supposed to do in order to live healthy. Yeah, we really need to take good care of our health because our health is everything. Life is very, And as I said before, my mom normally said, and
Information is
yeah,
power.
No, definitely.
and again, information is power. Information, if we have the right information, I think we'll definitely. So, now we have come to the end of our topic today, diabetes. What do you give our audience? What advice do you think you would give our audience?
I think following from, we started it from the first session where we talked about going for your checkups.
Okay.
Yeah. So I think it's whether we're talking about diabetes, we're talking about high blood pressure, it's the same. You, from the age of 40, you have to make sure you go for your checkup, go to your doctor, get yourself checked up, because that's when most of these conditions, if we've not been aware of them, that's when the body starts to struggle to continue to cope. So it's good you go for that checkup. And then after that, I would say anybody that is fit and healthy with no health problem, it would be a good idea to go for a yearly checkup. Would be a good idea, where you go to your doctor, they'll run some tests, check your blood pressure, measure your weight and your height, make sure your BMI, you're still okay. And if we do it that way, I think we stand a better chance. And then once you've been diagnosed, then of course going for your reviews. So your doctor will tell you when your next review will be, and you try to stick with it. Yeah.
But sometimes they give these excuse money, which I really agree. They don't have money. So in that aspect, what should
you do? I suppose
It's
it's a difficult one, but like we said, half bread is better than none. If you go to the clinics that many times, you would expect to pay that many times. At least if you try to, I'm sure you have to treat yourself now and then to that nice purse, for example. Using that money to then go for once a year checkup, I think would be money well spent, because you have to be alive to then be able to enjoy. But unfortunately, I know there are some other people as well that can't even afford that. That is what do we do?
It's a bit tricky, but they do run some of these outreach health services. Okay, because even in my village now, every 2 weeks, we run an outreach, blood pressure, BG monitoring service. Every 2 weeks, just come. So even if you get wind of such things, attend there. You get your blood pressure checked. You get your blood glucose checked for you. So that's an indirect way of monitoring yourself. But if they identify that there's a problem, rather than buying that wrapper, because it's usually, oh, we don't have money for this, we don't have money for that.
Meeting.
But thank you. But when they're having all these things in the village, then the money comes out. Oh, when there's a death, it looks like somebody dies before you can do anything. It's all talking of about Shebi. That's what people talk about now. Don't invest in that. Your health is more important. Your health is more important, because that you've started treatment does not mean there's a cure. No, it's not. It's managed. And that management is you keep monitoring and reviewing need. Are we good where we are? Do we need to add on? Do we need to, rarely do you take out anything in diabetes? And I think sometimes my professional colleagues don't do this too good. If you're managing type 2, you rarely take out, you add on. And there should be a treatment guideline as to where you start and add on in addition to monitoring. So there are ways, yes, everybody appreciates the difficulties that we all encounter back home, but we have to be alive to do things. If you're not alive there, you're not going to do it. So you've got to make sacrifices here and there.
Yeah, so Dr. Kosla, in addition of what you said, so what advice do you give to our people?
The advice, actually, in my sentence, I've said it as well. However, for treatment, there is no treatment cast on stone. For those providing, let people know about the side effects. As the topic for the day is diabetes management, most of the things you use in managing diabetes will cause low blood sugar. You should be made aware of the symptoms of hypoglycemia. Metformin doesn't cause hypoglycemia. Any other thing you use in managing diabetes does. And what you will get, the signs you will get will be that headache, shakiness, sweating, just being restless. You're not your usual self, just being restless. I know there will be a case of balancing your strips and any other thing. On that first occasion, it might help just to use your strip and check to see if it's low blood sugar. And if it is, and you start the treatment will be a sugary drink. Coke, Miranda, Tango, Sprite, Pepsi, whatever, not the diet ones, the regular ones. Not the 500 ml bottle, 100 ml bottle. Because if you do a 500, you overdo it. It's a 100 ml bottle. And after taking that 100 ml bottle, you may feel better. Sometimes you may need to do the 100 ml again. And if clinically those symptoms improve, then that would suggest that your blood sugar is coming up a little bit. Give yourself a bit of time. You need to follow that up with a starchy carb. And the starchy carbohydrates will come, either just one biscuit, cabin would be okay. Half, or you can cut the gala into 3. 1/3 of that would help. I believe the sun makes insulin a lot more sensitive, therefore there will be a higher risk of hypoglycemia. And for majority, there will be a lot of walking up and down, and as you walk around, you use up energy doing that. I know we emphasize the need to exercise and exercise. Yes, it's good to exercise, but if you have insulin on board, then there are specific measures you have to put into place to stop you from having hypoglycemia. And such measures are, before you start off that exercise, if you're going to go on a long walk, if you're on insulin injections, then you need to eat some carbohydrate, which will come in the form of banana is wonderful. Banana is wonderful. We have so many foods out there. Cabin biscuit, I can't recall any other biscuits you have back home because I like cabin a lot. So cabin biscuits, 1 or 2, will be fine for you because it's low release. And you go and do your exercise. And when you come back, have your evening meal. And before you go to bed, possibly another half biscuit. Because once you've exercised, your body is a lot more sensitive to insulin. And that sensitivity puts you at risk of diabetes for the next 24 hours. But it should not stop you from exercising. It's just that you have to manage the diabetes and the exercise. And managing that is eating more carbohydrates in between to help you normalize the blood sugar. Monitoring, you need your reviews. Either you opt to go, if they are having outreach services, you can have your blood glucose checked at those places. But if not, have it checked twice a year might be ideal, because there's another blood test, and I know it's there back home, that you do, the HbA1cs, that will give you an idea of what your overall control is over 3 months. And the expectation, you guys still do it in percentages, so it should be less than 6.5%, and that is suggesting good control, and that is 48 millimoles, assuming you're doing it in good currency. And that's a measure, because if that HbA1c it's not good, it's in double digits, it's suggesting to you that you are at risk of complications of diabetes. But if you have your HbA1c consistently less than 6.5% or 48 millimoles, your control is good, and in the long term you stand a better chance, even if you kind of flake here and there, but the HbA1c is good. All the research out there does suggest that you have a better control. So if you can't afford it, but you can do it once a year, it just gives you an idea as to what the future has in store for you. And those are the little things that you need to monitor. It's monitoring, going for reviews, playing your own part, being active. Amongst being active, you manage the diabetes and exercise. Because you're not just going to pack it in, because you're going to have hypo now. You can easily. I mean, there are people here that have type 1 diabetes on insulin and they've won 5 Olympic medals, including in rowing. Can it be any worse than that? So it's doable. It's just being aware of it and taking steps to stop it from happening.
Wow. Wow, thank you so much. It's really amazing and very rich information. Right, so we are ending today's topic on diabetes. Our next topic on
We'll decide.
We'll decide. Watch this space.
Watch this space.
So let's talk about our health and well-being. We've closed for now, and our next topic will dive later. So listen to all we are saying and take good care of your health. Health is very, very important. Let us stop being nonchalant about our health. Health is wealth. If you're alive, you have everything. If you are healthy, you have everything. Everything. Please, let's live and make sure that we maintain a very healthy lifestyle. Thank you so much. Thank you for listening, and yeah, see you next time. Thank you.
Thank you.
Thank you.
Yeah, I really appreciate.
Thank you.
Honestly, thank you so much for this information.
I appreciate it.
Thanks.
Thank you.
Bye.